Good evening, everybody. Thank you for joining us for MTN's latest town hall event, Kids in Crisis, a look into issues plaguing Montana's high school children based on data from the 2021 Youth Risk Behavior Survey. Now, for those unfamiliar with the survey, it's given annually to kids between 7th and 12th grade in every Montana school district. We've been focusing specifically on high schoolers in a series of reports we've done on topics ranging from depression to sexual violence to weapons in schools. Now, we're going to show you those stories in just a moment and then dive deeper into the issues with our panel of experts who I want to introduce now. First, we welcome Dr. Renee Schoening, the Executive Director of the Montana School Counselors Association. You'll see Dr. Schoening in several of our stories. She was also a longtime counselor in Deer Lodge and ran a private practice as well. Hello, Dr. Schoening.
Hello, thank you for having me.
Next, we're going to bring in Heather Zalewski, the Chief Medical Officer of Psychiatry at the Shodair Children's Hospital in Helena. One of her main passions is to reduce youth suicide in Montana, and to that end has been one of the organizers of the Montana Conference on Suicide Prevention since 2015. Thank you for being with us, Dr. Zalewski.
I'm not Dr. Zalewski.
Nope, as I look, we're going to say hi to Dr. Zalewski in a second. This is Marianne Dunwell, a four-term Montana House Representative for District 84 in Helena, who's now running for a state Senate seat. She sponsored HB 227 in the Montana legislative session in 2021, would have established grant money for mental health screening programs in Montana schools. The bill was tabled, but it was actually the fourth time she's introduced legislation related to the topic. Hello, Representative Dunwell.
Hello, Casey. Thank you so much for the opportunity to speak about this crisis.
Absolutely. And thank you both for now so much for being with us. Again, Dr. Zalewski hopefully will be right back. We had her moments ago, so I'm sure she'll be able to sign back on with us. Let's start tonight focusing on an all-time survey high, with 41.4% of high school students saying they feel depressed, and more than 1 in 5 saying they have seriously contemplated suicide in the past 12 months. Let's take a look. This is the Montana Youth Risk Behavior Survey. It's a 98-question survey taken by 7th through 12th graders all across the state anonymously. It's basically a way to measure how safe kids feel across a variety of issues. And the 2021 data is telling us that there is a massive call for help.
The numbers were really scary to me. I thought that they were higher than I anticipated.
And Renee Schoening is no stranger to the survey. Prior to becoming the Montana School Counselors Association Executive Director last June, she was a K-8 counselor in Deer Lodge for 16 years.
I think that early intervention is key, and that's where we can make the most impact.
2021 is the first in the survey's 30-year history to be conducted in a pandemic, and the numbers show just how traumatic of an event COVID has been. 41.4% of high school students reported feeling depressed almost every day for at least 2 straight weeks. That's an all-time high, especially for women who self-reported at 52.6%.
It's not surprising to me because of what we've been through the last 2 years. I think that kids need connection, and there's been so much less connection.
From what I've experienced this year, I have 100% experienced an increase in, student mental health concerns.
Jessica Buboltz is the MSCA board chair and a current counselor at Missoula Hellgate High School. Both she and Schoening are in Billings this week for the group's annual conference, which is focused on counselor burnout.
Something that we talk about is making sure that we have skills to help ourselves.
One of the heaviest issues Buboltz and her colleagues deal with are student suicidal thoughts. 21.7%, more than 1 in every 5 students, said they seriously considered suicide in the past 12 months. 18% actually made a plan, and over 10% attempted suicide 1 or more times. How does it affect you?
It's hard. Working really with any person who is in a place where they're thinking about taking their lives, that's difficult.
Suicide is definitely the hardest thing to have come across your desk.
You just said it right there, Dr. Schoening. You ended that piece, and we're going to start with you in a second, but I believe we have our two other guests with us as we bring in Dr. Zalewski there from the Shodair Children's Hospital in Helena. Thank you very much for joining us, Dr. Zalewski.
Hi, good evening. Thank you for having me.
And joining us is now Dr. Eric Arzubi, the co-founder of Frontier Psychiatry here in Montana. Dr. Arzubi also served as Billing Clinic's chair of psychiatry from 2014 to 2019 and is also on the board of directors of Prevent Child Abuse Montana. Hello, Dr. Arzubi.
Hi, good evening. Thanks for having me.
Thank you for being with us. Let's go right back to you, Dr. Schoening. We're talking about the idea of a student coming to you and coming across your desk with suicidal thoughts. You've had that personal experience as a longtime counselor. Can you share that with us?
I have. It's devastating. I think the one thing about being a school counselor is that we're very accessible to students. We're right there in the building, and we can intervene in the moment when they may have something that triggers something that triggers a need for them to be able to talk to someone right then and there. And so I think that's why school counseling has been my passion for so many years. I was in private practice prior to becoming a school counselor, but as a school counselor, I have access to kids and they have access to me where they wouldn't if I were in private practice. So I really value being right there at the school, knowing that kids have access.
Dr. Arzubi, Dr. Zalewski, neither of you are at the schools, but you deal a lot with child and adolescent psychiatry. Can you weigh in on any personal experiences here with children and suicidal thoughts?
Sure, I can jump in.
Please go ahead.
Yeah, so I'm the medical director at Shodair Children's Hospital in Helena, and we've definitely seen an increase in children presenting with suicidal ideation over the past year. To give an example, right now, the wait list for kids to come into our acute unit, those are kids that are currently in crisis, is 31 kids. So that's 31 kids across Montana that most of whom are presenting with suicidal ideation, suicide attempts, and are waiting to come into an appropriate psychiatric bed and are being held in emergency rooms or on pediatric floors. So I think that just speaks to the severity of the crisis that we're in.
How much bigger is that number than what you've seen previously?
It's significantly longer of a wait list than we typically experience.
Dr. Arzubi?
Sure. So I'm a big believer in school-based mental health. In fact, one of the things I did before coming to Montana, and then actually upon arriving in Billings, is help to try to set up school-based health centers, because unfortunately, schools and school systems are, being relied upon to be many things to our children, and that includes not only being educators, but also in some cases being social supports and mental health supports. And so it's really a tough spot that school systems are in. And so it's the job of folks like me and Dr. Zalewski to kind of be as supportive in the community setting as possible, so we can really collaborate and support one another. But big picture is it feels like every year that goes by, it's getting worse, and there's always a reason, right? If it's not the pandemic, it's something else. But it's almost like we're beyond a crisis now. Now we have a chronic systemic problem that needs really more attention.
Representative Dunwell, I'll get to you in a moment, but you just saw on the bottom of our screen there, I do want to encourage anyone watching on our Facebook platforms, if you have a question for any of our experts here, please type it in the comments. We have behind the scenes readers here trying to weigh through all of them, and we'll get to as many as we can tonight. Back to you, Representative Dunwell. You have a more personal experience with this as a parent. Is that true?
I do actually. Things are fine now, thank goodness. But as a parent, this was years ago. And my child was in middle school and then high school. And I'll tell you what, I want to put a plug in for Helena's Project for Alternative Learning. It saved him. So actually that's what made me prioritize youth mental health issues when I was elected to the legislature. It's one of the reasons I ran for the legislature, because I saw some of the needs and some of the gaps that need still really today need to be filled in our mental health system, both for youth and adults, from the continuum, community-based through the state mental health hospital. We could do a whole program on that, but
Right.
but I do, and as a parent, you need to be an advocate. The public school system is there to help, was there to help me, and I give a huge shout out to Shodare was there to help me as well, and I'll never forget that. I'll always remember how helpful Shodare was. Another lifesaver. So yeah, I don't know how much more you want me to say, but
Well, thank you for sharing your experience. We greatly appreciate it. Obviously, it's a conversation that is so difficult to have, and it's one that so many people are unable of having. And I think that leads to a lot of problems that we see today. The fact that many people are just not comfortable speaking about it.
yeah, and I do try to speak out as often as I can about this, because what we need to do is we need to tackle the stigma. We've come a long way destigmatizing mental health and behavioral health. There's still that stigma there. I think that's a big part of why my bill 227 for youth mental health screening in schools, I think, big part of why it failed.
Earlier this year in eastern Montana, authorities found a 26-year-old woman from Sydney, Caitlin Berry, dead after being reported missing for 3 weeks. Now, the official cause of death was hypothermia. She didn't have a coat on. It was left inside of her house. Her family says she was struggling at the time with diagnosed mental health issues. Now, we don't know the specific details of that night, but what does a story like Caitlin's make any of you think of, someone who was struggling like that and maybe didn't have the resources that could have helped her?
So I can, if it's all right, I can jump in. I mean, again, one of the things I'm trying to do is to shift the way I'm talking about these issues. Again, I've gone beyond calling this a crisis to now really a systemic problem that's chronic. Because if this were a crisis, it would be time limited. The other thing is, I don't know if it's stigma. I actually would almost offer this part perhaps being discrimination, and really trying to use stronger terms around this. What about, Dr. Zalewski mentioned there are 31 children waiting for access to acute psychiatric beds. Imagine if we were saying that we have 31 heart patients who've had heart attacks, 31 patients waiting for a bed, and they're being sort of stored somewhere, warehoused somewhere while we're waiting to get care. So I would almost offer stronger language and say, really, we're talking about discrimination against folks with mental illness, rather than just sort of simple stigma. Stigma doesn't help us move the conversation forward, I think.
Obviously, the COVID-19 pandemic, you said, has played a role in this number being an all-time high. From what all of you are seeing now, do you expect things to get better as the pandemic restrictions lessen at all?
I think we've only seen the tip of the iceberg of what the enduring consequences are going to be of the pandemic. I think the isolation, things always are on a bit of a delay. I think especially with kids, when they have things impact them when they're young, you see delayed consequences in their development, in their ability to learn, and all of that. So I don't think it's going to get immediately better. I think we're going to have long-term consequences from this.
I want to bring up a comment made here by Kelly McMurphy. She says, children getting bullied in school is a big problem. If we could get the bullying to stop, maybe children wouldn't think about suicide. She brings up an interesting point of not just in person, but also cyberbullying, which is becoming such a large issue as people move more and more toward online communication. How much of a role does that play?
It's one of the social determinants of this. I love this discrimination and chronic systemic problem. Dr. Arzubi, I really like that, and that's what we have here. So I think what we need to do is look at it as not getting better unless we really devote some financial and resources and stop the discrimination and move forward with addressing the problem, because mental health care is health care. And Dr. Arzubi is right. If we had 30 patients in line in the hallways waiting for care, there would be, I think, more of an outcry.
And I would agree that bullying is a huge issue, and cyberbullying is even more of an issue. We know that oftentimes when children attempt suicide, the trigger for that is a relationship crisis. So whether that's being bullied in person or cyberbullying, definitely that sort of thing can precipitate an immediate suicidal act.
You talk about a relationship crisis. Let's move on to our next story, which deals with sexual violence numbers in the 2021 Youth Risk Behavior Survey. 13.5% of high school students say they had been the victim of sexual violence in the past year, and there are almost as many who say they've been raped. Take a look.
Really difficult to hear, especially when you think it's 1 in 10 kids.
Renee Schoening, a longtime Montana K-8 counselor and now executive director of the state's School Counselor Association, is referring to this number. 11% of high school students say they have been physically forced to have sexual intercourse when they did not want to. The more common term is rape.
It doesn't really surprise me just because I've been doing this work for a very long time. And I've heard a lot of stories.
But sometimes it's not necessarily reported to the school. Sometimes it'll be reported either to the authority or other resources that we have within the community as well.
Jessica Buboltz, a current Missoula-Hellgate counselor, says her school administrator will report alarming cases to police. Missoula County's numbers are slightly lower than average at 10.1%. Yellowstone County is right in line at 11.1%. According to Billings police stats, there were 37 offenses for sexual abuse of children in 2021 and 15 offenses of statutory rape.
As a community, as Montana, I think it's something that we need to work towards. All schools across the board.
The numbers are worse in the state's more rural districts. Golden Valley is one of 2 at over 20%. Muscle Shell is at 16.2%, and Bighorn County is the 3rd highest in Montana at 17.5%, almost 1 in 5 kids.
And it's the schools that are in those isolated locations that need it more than anybody, because many school counselors who are working in rural districts report that they're the only one with any mental health training for 100 miles.
It's why Schoening has dedicated her life particularly to this issue.
When they know that that's not normal and you give them the tools and tell them what they need to do if they experience something like that, then they can go get the help that they need. We have to do something for our kids. We have to. It's not an option anymore.
So we'll begin with you. You told me that after suicide, having a child come to you saying they've been the victim of sexual violence is the next hardest thing to hear about.
Absolutely. It's so difficult to know that they've been offended in that way. And, in a way, it's hard to hear, but in a way, I celebrate the fact that they would tell me, because then we can do something about it. So one of the things that strikes me about the story that you just played was, I think there are so many unreported cases of child abuse, sexual abuse, or other abuse. And that's a real concern. I think we have a culture of shame that prevents people from coming forward when they've been sexually abused or have had sexual intercourse without consent. And so that's a real concern, and kind of speaks again to what Dr. Arzubi was saying, that this is a systemic problem and a cultural problem. We have got to address the shame around having a mental health problem or having been offended in some way. And to really, because secrecy feeds shame, and that often is why we aren't able to help, because we don't know.
You mentioned the numbers not lining up. Obviously, the numbers of sexual violence cases reported in Billings are nowhere near what an 11% number would do for the city's high school students, which number in the hundreds. It is important. I do want everybody to know that the Youth Risk Behavior Survey is a completely anonymous survey, all 98 questions answered without any names, ages, sex, race written down. The 11% average is high enough, but you see it go over 20% in some of Montana's more rural communities. It's often where they have the least amount of help. Is that fair to say for whoever wants to jump in?
Casey, may I jump in, please?
You sure may.
You know, a few years ago, there was this spectacular story about James Jensen in eastern Montana, molesting young boys.
Yes, a story out of Miles City.
Athletic trainer, yeah. And so that prompted me to sponsor back in 2019 House Bill 109, which would have repealed the statute of limitations, because in his case, the statute of limitations was up, and he actually Facebooked, aha, I made it without getting caught. Turns out he was caught with child porn on his computer, but he was never prosecuted for the molestations. And so my bill would have repealed the statute of limitations because, you know, in addition to the shame, there's threats. The perpetrator is often somebody that the young person knows, and it threatens them with their life if they tell anybody, and especially kiddos. I mean, they're scared in this, and oftentimes they block and a psychologist can tell you more. Dr. Schoenberg, can you tell? I apologize, Schoening can tell you more, but they can block the experience for years and years and years, and maybe not remember the experience until they're 40. And it explains so many of their current, maybe aberrant behaviors now. And so there should not be a clock on kids and prosecuting this heinous child sex abuse. So, you know, when I remember one of the folks who testified for my bill was retired Montana Supreme Court Justice Jim Nelson. And what he said was, there are literally thousands of cases in Montana that go unprosecuted, unreported and unprosecuted. And that's just not okay. And he also said that a lot of this stems from institutions' lack of action and cover-ups. We've seen some of those in the news too.
Sure.
So thanks for letting me. I think we're just seeing the tip of the iceberg.
Sure.
I apologize. I just had just a couple quick thoughts about this. You know, I'm thinking about bullying and sexual abuse. There are parallels there, right? Because what happens is a lot of bullying sometimes goes under or unreported because children don't trust what adults are going to do about it. And the same thing with sexual abuse. A lot of sexual abuse goes underreported, unreported because the children don't trust what adults are going to do with this. So again, I just really, number one, I invite us to think about, is there an issue more important than the one we're talking about today? Is there? And then the other one is, I really would invite us adults, all of us, to look in the mirror and really hold ourselves accountable to what can we do in our institutions and also culturally to make children feel safer, because children aren't feeling safe. And this is why bullying and sexual abuse are having the impact they're having on our kids.
Well, Dr. Arzubi, you're on the board of directors for Prevent Child Abuse Montana. How big of an issue is sexual violence in your conversations and your experiences with that group?
It's enormous. It's enormous. And again, like we keep hearing over and over again, right? Tip of the iceberg. It's underreported. Numbers are much bigger than we anticipate and than we expect. And certainly, I imagine Dr. Zalewski would maybe share this, and in that so many conversations that I have with children who are struggling with mental health problems, the exposure to abuse is just really ubiquitous. It's happening all the time, and it almost feels like every other child I talk to has really struggled with this. So it's out there, and it's a lot more than people think.
Yeah, I think at Chaudhary, we are a sanctuary certified institution, which means we base all of our treatment on a trauma-informed model. And really our philosophy is essentially that trauma is everywhere. And, you know, there are the Individual traumas, which of course sexual abuse or rape or bullying are all examples of individual trauma. And then what I have seen and what I feel is happening and may partly explain these high numbers that we're seeing is I really feel like the COVID-19 pandemic has been a collective trauma. Because of the isolation, because of loss, because of disruption in routine. I mean, for so many reasons, families who are now struggling financially. The list just goes on, right? And so on top of all of the individual traumas that we're all trying to deal with and that the children are trying to deal with, we now have this collective trauma that we're also trying to deal with. And frankly, I think it's just too much for kids and, they're not doing well.
Right.
And we see that every day.
I want to
agree
real
with
quick.
that.
Sorry, I just want to get to one more viewer question that we have in here. This is from Leonard Bryan. He asks, what is the first step in growing the facilities for the kids that need immediate care? Is it a financial issue? Is there any volunteer organizations one can join? And lastly, what platform can I use to stay informed on this current information for our kids?
Well, that's like a 17-point question, but I'll take a stab at least a couple of them. So, one thing to be hopeful about, because I do feel like, as adults working with kids, yes, we have to be empathic and we need to advocate for them. And we also need to hold out hope for them. And Shodair is building a new hospital that will have greater capacity, more beds, all single rooms. So we are on track to be done with that project by the end of this year and moving in January. So there are things to be hopeful in this space. I don't want everything to come across, doom and gloom. We do need money to build the new hospital. So sure, that would be lovely. I know our foundation director would not be happy with me if I didn't put that plug in. And then as far as volunteer organizations, there are a lot of volunteer organizations. I don't think I could do justice to a comprehensive list, but I know Big Brothers Big Sisters is always looking for volunteers. NAMI Montana has a Families to Families program. You can become a CASA advocate and be an advocate for a child who's in the custody of Child Protective Services. So those are just a few that come to mind, but there definitely are opportunities to help.
And I just like to say, some of the opportunity starts at the legislature. We have the power of the purse. And last session, I was heartbroken. House Bill 2, which is the big budget bill that the legislature passes every 2 years. There was a $2 million appropriation for CSCT, Comprehensive School and Community Treatment Program. And I voted for it, but the majority didn't, so it didn't get through. And that's the program right into the schools. And Dr. Schoening can probably speak to that. And also there was $1 million of funding that didn't get passed for public health, suicide prevention type efforts. And it takes money to address these problems.
Okay, Dr. Dunwell, you bring up an interesting point.
Oh,
Dr.
thank
Schoening,
you. I'm just representative. I'm not a doctor.
I'm sorry about that, Representative Dunwell. Dr. Schoening, you've said one of your legislative goals for next year is to reduce kids per counselor ratio. Right now, just one counselor is required for every 400 kids. Is that correct?
Exactly. And Heather said something really, really key, which is that trauma is everywhere. And I believe that every school should be a trauma-informed school. And that takes money, that takes staffing. We need more school counselors to do that preventative kind of systemic work to help the school climate be more positive so that schools are feeling safer for every single kid. School counselors are there for every single child in the school. And we can't assume that kids are okay. We have to understand that they have all endured trauma. No one is immune from this pandemic. And we often have many kids who are enduring traumatic events that we're unaware of. We have to be trauma informed in everything that we do in every school in Montana. And that's going to take some real work and real work in adding staff and hopefully getting more school counselors out there doing that good work. And I too really appreciate the CSCT work that we've done. That tier 3 level service is for those students who are needing really intensive intervention. And so those programs can, have maybe 18 to 20 students in their programs to work very intensively with a therapist and a behavioral specialist. That's needed too. We need to hit this from all angles. And the schools are the center of that work, I think, because we work with so many. And I'm just really hopeful that we can get this through.
Representative Dunwell, I mean, everything that Dr. Schoening wants to do takes money, as you know. How does she get those things done?
Well, advocate to people like myself, to your state legislators, to the governor's office. We need all hands on deck because, as Dr. Arzubi said, this is a chronic systemic crisis problem, and it's not going away anytime soon. We just, a budget is the reflection of our values, and
Exactly.
we need to value mental health treatment and prevention more.
And we need to value children. We need to value children. They can't speak for themselves. We need to speak for them. And as I've said, when I've talked with Casey before, if we don't pay for this now in early intervention with kids, we pay for it on the back end. Okay, consider the cost of human life, the loss of life to suicide. We have got to do something about that. We have got to do something about giving people the tools for self-regulation. That will save the correctional department. Again, earlier intervention. If we put money toward kids and schools, we do save it in the long run.
Can I tell a quick story about a parent? I talked with a parent who lost her daughter. Her daughter died by suicide, teenager, in my district. And the parent said, before she passed, I would have been opposed to mental health screening. It's none of your business. She said, now I would give anything to have had that, to identify her daughter as at risk, because she was one of the youth who knew she was a star, a sports star, this and that, who knew?
Right.
And those are the, those are the folks that slipped through the cracks, these kiddos, and that's what screening identifies.
Yeah.
Appreciate you sharing that. Let's move on to our final topic here, weapons in Montana schools. We released these numbers last month after a third Billings teenager was killed by a shooting in a 90-day span. Take a look.
Saturday night shooting happened here on the 500 block of South 33rd Street. It's the third teen shooting death in the last 3 months in Billings. Police say it's because children have more access to guns now than ever before. And the 2021 Youth Risk Behavior Survey numbers prove that.
What we see is a number of firearms in the residence that are easily accessed or loaded.
In the anonymous survey, which is used to determine the top causes of social problems among youth, 9% of Montana high school students say they've carried a gun one or more times in the last 12 months, not counting for hunting or shooting sports. That's 1 in every 11 kids. Billings Police Chief Rich St. John says BPD's forthcoming 2021 annual report shows a similar trend.
The number of incidents that involve firearms was staggering. Not every firearm incident resulted in an injury, but there was a significant number of all age groups that were shooting.
15-year-old Cohen Parker, a sophomore at senior high, was killed in the early morning hours of January 16th on SD2 property near Castle Rock Middle School. No arrests have been made in the case, but it points to another survey stat. 9% of students say they had carried a weapon, such as a gun, knife, or club, on school property at least once in the past 30 days. Saturday's incident is not being treated as suspicious, but police are continuing an investigation to determine if any charges will be brought.
A loaded firearm got in the hands of a teenager, and we have a fatality, and it could have been avoided.
St. John says it's a sad story that's becoming all too common.
Make sure that the guns are secured, unattainable, and that they're not loaded. There's plenty of tools that make firearms safe, and it has nothing to do with gun control. It's all about securing firearms so the family members are safe and people don't get into it that aren't supposed to.
Now, those tips are directed at adults. Gun safety, clearly an issue in a state that has a strong gun culture. Dr. Zalusi, I want to ask you a question here. You've organized the Montana Conference for Suicide Prevention since 2015. What role does gun safety and gun availability play in your discussions?
Gun safety and gun availability is a huge topic. We know that teenagers, as I've already said, are often triggered by relationship crises when they become suicidal. Excuse me. And they're very impulsive, right? Their frontal lobes haven't developed. They are prone to doing very impulsive things. So you put that with a loaded firearm, and that is most often the cause of suicide death.
Dr. Arzubi, are children comfortable talking about guns and weapons? And what age group does that first come up in?
Sure. I think it depends. A lot of what we're talking about depends on sort of, home life and how comfortably things are discussed at home. So I wouldn't be comfortable sort of generalizing, because I think it varies from family to family and culture to culture. But, what I can certainly tell you about Montana as a state, the gun culture is more robust than in many other states. And so I would say in Montana, I would argue it probably happens sooner than in some other states, given that there is such a prevalent gun culture and culture of hunting. So again, I think a lot of it goes back to, like you mentioned, the adults. How are the adults handling this at home, in schools, and being proactive about educating and making it a comfortable topic of conversation, and really being really safe with our recommendations.
Representative Dunwell, school shootings have become an all too common occurrence across the nation. Have you had conversations at the legislative level about this issue?
Oh, have we? Yes. And sadly, Casey, I mean, it turns out to be a fight about the Second Amendment. And that's so far from what it really is. I mean, Montana has a heritage of outdoor hunting, and many families hunt to put food on the table for a year. My late husband's family, his uncle always got his elk, and Aunt Kate had her freezer filled for the year. It's a culture, and outdoor sporting events are part of the culture. The thing we need to look at is how we store those guns. And most gun owners are extremely responsible. They know the dangers of firearms and store them properly and locked up. And what I propose to do, and I've carried legislation to encourage and fund proper gun storage of firearms in homes, because it's just not okay to leave a firearm on a coffee table where there's a toddler walking around. And that those are the minority occurrences. Of course, when something goes awry and there's a fatality, that one case is a life, and it becomes a headline. And we're seeing that all over the country. And you just showed an example of in Montana, a young man brought a gun to school. So the conversation goes on. The bills typically never get out of committee. I think what we need to do is emphasize that this is not taking away guns or destroying our gun culture or our hunting culture. It is responsible gun ownership for the individual and the community, for public health. It's a public health issue.
We have a question coming in from Natalie Smith Crawford. She says, how about we teach gun safety in school? Dr. Schoening, you've been in schools for many, many years. Your thoughts?
I do teach gun safety in schools. It's part of the child protection unit that I have taught. And hopefully there are other schools that do that. I can't speak to that. But again, we teach safety of all kinds in schools, and feel like it's an important part of what we do for students. So
Do you believe it should be something that's mandated at a statewide level?
It's not a bad idea. I mean, it's hard when you start talking mandates, because we are a local control state, but I do believe it's important to prioritize safety of all kinds. So, and I would like to think that families would take part of that responsibility as well. I think it's really important that families care enough about their kids to do what they need to do at home as well. If we start putting everything on schools, I like to encourage parents to have more ownership over those things.
That's the time we have tonight. I want to give each of you a chance to wrap up anything if you feel like there's something to be said that you didn't get a chance to. Dr. Schoening, I'll start with you.
I would just like to say that I am just so proud to represent the hundreds of school counselors in the state of Montana. I am just one of hundreds. And the work that they do every day is so valuable. I just want to give a shout out to them. It's a tough time to be a school counselor. They are in the trenches. And one thing that we talk a lot about are the suicide rates, completed suicides in our state. But what we don't often hear about are the ones that were prevented by a school counselor. And that happens very often, more often than we'd like to think. And so I just want to give a shout out to the hardworking school counselors in this state.
Thank you very much. Dr. Zalewski?
Yes, I just wanted to thank you for having me and for hosting this very important segment and for all of the reporting that you've done on this. I think this survey only confirms what we, the clinicians working with kids, already suspected, which is that kids are really not doing okay. And I really feel like the more focus we can put on that, the more attention we can put on it, the more hopeful I am that we'll be able to come up with some really positive solutions.
Thank you for being with us. Dr. Arzubi?
Sure. So a couple quick things. One is, I think certainly teaching gun safety in school and other settings is important, but I would also invite us to, again, let's think about doing things differently than we have in the past, because what we've been doing isn't working. So, for example, how about we teach how to talk about mental health in schools, right? Let's teach kids, what is anxiety? How does it feel like? What are the signs? What is depression? So having vocabulary to talk about feelings so that kids can express themselves better and communicate better with adults. And then again, the other thing is we need to have hope, but I think we also need to be very realistic about the fact that, again, this is no longer a crisis. We have a chronic systemic problem that needs desperate attention. And while it is about money, I think really we need to think about better decision making with the money that we do have. And really, if we feel this is a priority, let's make the budget look like that, so that it prioritizes really the safety of children and the long-term health of our communities.
Well said. Representative Dunwell.
Well, thank you, Casey. I'm going to echo the other guests. I really, really appreciate you hosting this conversation, because it is a systemic, chronic problem, and we need to talk about it to lose the discrimination or stigma, however you want to look at it, all around. I'm just going to end with one fact here. Early intervention is the key, and NAMI Montana released this fact that when you have high school interventions like Youth Aware of Mental Illness and a number of other evidence-based programs, mental health screening is just one of them. But when you have those implemented in high schools, this was a high school study, you reduce suicide by 36%. And that is huge, because even one life is priceless. So let's invest, let's get all hands on deck and address this systemic problem. Thank you.
Well, thank you very much. Thank you all for being with us tonight. Your expertise is invaluable in these crucial conversations. The 2022 Montana Youth Risk Behavior Survey is expected to be released in the fall, so we'll revisit these numbers to see what's changed, and we'll see what the 2023 Montana legislature has in store for our state schools. If you want to watch this conversation again or pass it on to anyone else, we will archive this on both our MTN Facebook pages and our MTN streaming apps. It'll be immediately available on Facebook and hopefully later tonight on streaming. Thank you for watching, and have a good night, everybody.
Thank you, Casey.
You've been watching an MTN Town Hall event, Kids in Crisis, the challenges facing Montana's next generation. To learn more and find out additional resources, visit your local MTN website.